Hi, come on in and take a glimpse inside my pre and perinatal massage therapy class. I ask you to really get a feel for and a look at all of these ligaments. What you're going to see there, in addition to the usual of lecture presentation, is what you're not going to see in an online or a book class. Even the best of them, including my own, is hands-on work, lots of it. And now I'm aiming my pressure towards the ilium a little bit. So I went down to the table and holding that. We've got about 25 of the 32 hours of this class is in watching, doing, and receiving. We do these demos where I'm working on the client, the student, and then simultaneously there's a skeleton demo. And what you're going to get from that is you're going to get anatomical specificity, which means that the techniques that you're going to learn are going to be very precise, and they're going to be targeted to the kinds of things that pregnant women come in with. You're not going to just be seeing in a class like this just regular massage adapted for pregnancy. Hands, the sense of the directions of these and where the posterior iliac spine is. So I love to work individually with my students, especially table side. And so I'm working there to be sure that you feel the work, that the student is having a chance to get my feedback, that's getting a chance to really get, I guess you'd call it me strengthening their weaknesses and then also acknowledging their strengths so that they can really build on both of those things. And pulling your shoulder down. There you go. I love in our class that we spend a lot of time on body mechanics. And that means that you're going to have ways to use your body at the sideline position, which is a little different from prone and supine positioning with your clients, in such a way that you're going to be effortless. You're going to enjoy how you feel at the table, and you're going to be way less likely to develop some kind of an overuse syndrome that could end your career early. In fact, what we get as feedback from this class, from our graduates, is that the body mechanics is one of the things that they've appreciated the most about what they learned in the class. Another thing a lot of people like in our class is the wonderful balance between art and science. If you really respect both of those things, you're going to love being in our classroom, because we're using very updated research. We're doing anatomy, physiology, kinesiology, functional analysis of movement, but we're also addressing the emotional and the psychological aspects of not only pregnancy, labor, and postpartum, but what is it like for you as a therapist to work really closely with these mamas? I love our class because I think that we are giving you a real experience of respect for the time and for the resources that you have to invest in a face-to-face class. We show that by being on time, by being focused, by being organized in what we're doing. And we really want to make sure that we've got you prepared to not only just have a piece of paper, but to have a real education that you're going to be able to use to get the kinds of jobs that you're looking for. The work you'll see in this class is work specifically for pregnancy and labor and postpartum. However, it also really applies to many, many other specialized populations who need side-lying and semi-reclined positioning. So, if you want some more details, here's how you'll get them.